ahead.
So just talk about a little bit about who we are at PalCare. So PalCare is a regional palliative care research network made up of clinicians, researchers, methodologists, and people with lived experience. So here's our steering committee, and it includes representatives from hospice care, community services, hospitals, and academia. So there's a mix of clinical insight and research expertise in the group. And just to note as well, we currently have an open position for someone in social care. So there's a position that we're looking to fill. But simply put, the network's purpose is to support people working in palliative and end-of-life care to engage in research. So that could be someone working in health and social care who would like to contribute to studies, or maybe they wish to develop a research idea or lead research themselves. So our work focuses on the Northwest Coast, working across NHS organisations, hospices, and community services. However, many of the challenges and opportunities that I'll talk about are not unique to this region and resonate more widely across palliative care. So I'm going to start by talking about some research that our team has conducted to learn about the key barriers that clinicians face to engaging in research. And I'm sure that you're aware of many of these barriers to conducting research. And I'd like to hear actually from you later on, if possible, to hear about the barriers that you do indeed face when engaging in research. So here, I'll just highlight that also in the team we have researchers who've worked in clinical settings, so they're also very aware. But quite often, those who are not in the field, those who are not working on the front line caring, are not fully aware of these barriers or not fully aware of the implications that has. So it's important for us to do this type of research to open up the conversation about these barriers that clinicians and carers may face in engaging research. So it's important for us to open up these conversations with policymakers and decision makers. And that's where this type of research is important. And you won't be surprised when I tell you, after having done this research, you won't be surprised when I say that 3/4 of the participants who took part in this study were not currently active in research, yet nearly the same proportion said they would like to be involved in research. So there's a strong interest in conducting research, but this interest isn't translating into participating in research. So what's going on? So I'll just tell you first a little bit about the study that we conducted. So we did a survey of NHS and hospice staff working in palliative and end-of-life care. And the aim was to understand directly from the workforce what makes research engagement difficult for healthcare professionals and what would help healthcare professionals to conduct research. So respondents came from a wide range of professional backgrounds, including doctors, nurses, and allied health professionals, with nurses forming the largest group. And the respondents also came from a wide variety of settings, so inpatient, hospice, and community settings. And the survey included questions about research involvement and barriers, alongside free text responses to capture people's experiences in their own words. And this was then followed by facilitated working groups with smaller numbers of participants. And the purpose of the working groups was to help prioritise and deepen understanding of the survey findings. So here's what was found during the analysis, that 4 clear themes emerged. So first, organisational culture and capacity. So many people told us that research is valued in principle, but not built into job roles or workloads. And second, that many expressed that they felt a lack of confidence in research skills. This is not their main part of their role. So obviously, clearly, their key role is caring for individuals. And third, about research infrastructure. So people describe difficulties of accessing governance and approvals, research support, and particularly in hospice settings. And fourth, patient and public perception. So staff were understandably concerned about burdening patients and families, or about how research is perceived in palliative care. Moving on. And so just to explain a little bit, this is a little bit of the findings here. So on the left-hand side, you can see the overall responses to the survey. So these are arranged in order of frequency from highest to lowest. And then on the right-hand side, you can see the rankings from the working groups. And what you might, so each one of these themes was color-coded, and what you might notice is that blue does not appear at all in this sort of top 5 of the rankings. So again, highlighting that it's not a lack of interest in engaging in research, and people want to get involved. And when respondents were asked to rank barriers, consistently, lack of time and capacity came up. That was the most significant challenge. And this was also followed by uncertainty around the research processes, limited access to research training. So to give you a flavour of the types of responses we received, I'll just read out a few of the quotes. So this quote captures a common organisational concern. The clinical demands and their key performance indicators required by our service specifications and our trust demand that you spend the majority of your time, 90% if not more, undertaking clinical aspects of the role, and that there isn't necessarily buy-in to research. So it reflects the reality, really, of a busy clinical environment and the focus of the role being on care. Where research can feel like an added burden rather than an integrated part of the role of care. And then this second quote highlights issues around confidence and knowledge. So they don't know where to go to, they don't know how to find the literature, and they just feel like they're in a minefield of information. They don't know which avenue to take. So many respondents felt that research was something done by others rather than something they could realistically participate in, and not having a knowledge of where to go to get the information. And then this final quote speaks of the research capacity limitations. So the thought of actually undertaking some research ourselves, we're a million miles away from that in our hospice, We are trying to be involved in other bigger trials, but where to actually put through an ethical approval ourselves, we're nowhere near that here. So staff felt their hospice lacked the infrastructure and experience to conduct independent research here, and that includes sort of navigating the ethical approvals, which can be challenging if you're not aware of where to go. So, having highlighted some of the barriers that clinicians face, this work is fed into, I suppose, what we do here. And so now I'm going to talk about how we can support people engaging in research. So we can support clinicians in several different ways. So first we have a research development toolkit, which offers accessible bite-sized guidance for developing research ideas at any stage. I'll just point out that, you can see here it says hospice research resources. So it was originally developed to be used in hospices. It was originally designed for that purpose, but anybody working in this field of palliative care can also make use of those resources. We also run regular networking events every 3 months. So this gives clinicians and people working in the community gives them the opportunity to connect, share ideas, and learn from others working in the area. So usually that's in the morning sessions, you'll have some presentations from people in research, and then in the afternoons, we'll have some small breakout areas, some working groups where people can work together on some key issues that palliative care are facing at the moment. Alongside this, we also maintain a mailing list to keep people informed about opportunities, events, and resources. And finally, we have 4 research groups that offer a more focused space for collaboration and discussion, developing studies and to share similar interests. So I'll just move on to talking about the research toolkit, and this was developed with several partners. So here are the contributors to the toolkit. And so the resources are designed in short, practical ways and suitable for people who are busy, focused on a clinical role. It's split into 4 categories. So planning a study, setting up a study, running a study, and dissemination. And there's the web link underneath. So the first set of resources focuses on planning a study. And this includes turning everyday questions from practice into researchable ideas, so understanding study designs and identifying appropriate outcomes. So there are some bite-sized videos for each of these topics, which take about 5 to 10 minutes long, so they're not very long at all. And they give a short overview, so they're not long lectures, and they focus on some key takeaways about the research process. And then the second set of resources focuses on setting up a study. So this includes guidance on ethics, governance, consent, and working in research teams, areas that many hospice staff told us were particularly daunting. And we know that ethics sits really at the heart of both of our care work and what we do, but also in research. So naturally it guides what we do, but the practical steps involved in all of this can sometimes, the processes and the forms needed to gain ethical approval can be less obvious. And so that can take a little bit of time to navigate. So the aim of the information on this page is to sort of demystify these processes and provide some clear signposting. So this page is particularly good for providing an overview of that research landscape there. And then the third set of resources focuses on running a study alongside clinical work. So once you have developed a strong research question, you've got ethics approval, now it's time to start thinking about how you're going to go about conducting a study and how you'll collect information and recruit participants. So on this page, there are some useful fact sheets on this page about gaining informed consent and how to do this ethically and how to develop consent form. So in palliative care research, the realities of illness and fluctuating capacity can make gaining informed consent particularly challenging. So these resources are focused on feasible approaches. And then finally, some resources on dissemination. So when disseminating research, it's important to consider who the findings are for, how they can be communicated clearly and accessibly, and which formats or channels will best reach the intended audiences. So this could include presenting at conferences, writing reports or papers, and feeding results back to patients and their families and services. So there's some guidance on this page about writing a paper, and preparing findings for conference presentations. So, I'd say that the key point here is that the dissemination can take many forms, and it doesn't just have to be about publication, of course. It can be very much about impact and reaching the right people. And then I'll just, for those who are interested, I know Evan talked about funding for research, and so I'll just mention this here that we do here at Lancaster University. For those who are looking to go further into research here, we also support a PhD program here in palliative care research. So it's a part-time qualification, so it's a feasible option for someone who's working. And it's also very international, so we have students from all over the world who join the course. So it gives a wide range of perspectives coming from other healthcare contexts from other countries, and there's many opportunities for international collaboration. So I hope this inspires you to take the next step to getting involved in research. And if it has, I suggest as a starting point to go to the website, maybe take a look around at the free resources, join the mailing list if there's one of the research groups that you're interested in join with those, so you can stay involved with people of similar interest. So, thank you very much. And if you have to take any questions.
Thank you so much. Thank you so much, Deborah. That's a lot of resources there. And I'm sure our audience will be so much fascinated by the resources that you have shared. We will move on into a question. I can see Silas has raised his hand there. Silas, do you want to ask a question?
Hi everyone, can you hear me?
Yeah, we can hear you.
Thank you, Deborah, for your presentation. I've just got two questions. You mentioned you work with methodologists. I wanted just to find out what does a methodologist do with your network that you work with? Then the second question is ethical approval. Considering your area of work is quite a sensitive area, how easy is it to get ethical approval for a study? And what is the normal or average timeline? Thank you.
Okay, thank you for your question. So the first one about methodologists. So we have people on the team who can help with. So if you come up with a research question, maybe there are different ways of getting that information. So there's some people on our team who are very knowledgeable of this, who can maybe help guide you, whether it be doing some qualitative research. So maybe your question is focused on finding out the lived experience of people in the community that you're caring for, and so they can help you design maybe an approach, whether it be interviews or maybe it's having a focus group with their family or the carers. And then there's other types as well. So I think if you look at the resources, I think there's a video in there about how to develop surveys. So this would be another way of, I suppose, collecting information. And it's sort of finding the right methodology that links up to your research question. So this can also be collating quantitative data. So so you might need someone who's got particular expertise in an area of examining quantitative data, and so I suppose as well we could put you in touch with those people that you might benefit from working with. And then your other question about ethical approval. I think I read somewhere recently about ethical approval that it can take working in healthcare, I think the average time I'd read was 160 days. So it can be quite a long process. I do think that one of the areas that also makes it difficult, though, I don't think that it's difficult as such to get ethical approval, it's just knowing where to go. So again, on that resources page, it's there's some key signposting there that might help with that.
Thank you.
Good question.
All right, Deborah. So let's say a home care provider, they've never been involved in research, and they do work with clients living with dementia. Sometimes, people who are worried or concerned that probably, service users who are living with dementia may not be appropriate for research. Is it always the case? And how does a home care provider working with such clients be involved in research?
So, are you asking how to encourage?
Yeah, because there's a tendency to think that probably you can't involve dementia clients. Sometimes people, when they are research naive, they think probably it's for other providers, probably not for dementia clients or end of life. There's always that ethical concern, like what Silas was saying. How can we get to encourage such providers, or how do you get such providers involved in research?
So are you talking in terms of the carers, or?
Yeah, it can be the carers. Yeah, it can be the carers. It can be probably the home care provider itself. As a company, they want to get involved as well. They don't know how to get involved. What opportunities are there for them to get involved in some way with research?
I think, I mean, now research is very much interested in wider care settings. So I think this in itself creates an opportunity for the domiciliary care, if you like. So that there already, I think there's an opportunity there basically waiting. I think in terms of maybe working with carers, this is these sessions that you do like to do. But I think these sessions like today are good to open up conversations, and I think it is feasible for carers to get involved in research just to hear the carers' perspective.
Yeah.
I think obviously things get more challenging when you're doing research with people who are actually experiencing the illness. So you mentioned about particularly people with dementia, which is common in domiciliary care to work with people who have dementia. And there are some people in our team at Palliative who specialise in working with dementia. Professor Catherine Walsh is one of those. She has a lot of experience in that, and probably would be able to provide more specific guidance on that if you're looking for, how practically you can engage with people in that context. So that, I think that's worth pursuing that one. I can follow that one up for you as well.
Great. Thank you so much. Actually, I was gonna say NIH, because you mentioned there that there is a lack of protected time. As one of the reasons why some may not get involved in research, because 90%, like you say, 90% of their time they are busy doing either clinical work. I think it's the same thing as well in the home care sector as well. So there's no that sense that we've got time to do research. I was going to share that the NIHR does have some opportunities where protected time, the NIHR funds for protected time. And we were fortunate to be one of those recipients where some nurses that we work with have got one of their days per week being paid by NIHR to actually do research. And these are people who are new to research. They are learning everything about research, how to do research, lead research themselves. So NIHR has got such opportunities where protected, they can actually fund for protected time. But also I think there are opportunities like research champions where you are actually not necessarily doing or leading research, but you are promoting research within your organization as well. So for home care providers, you probably would want to know, such opportunities. Will just reach to us. We can also share, whenever such opportunities arise, or you can go straight on NIHR website. You can come across such opportunities. Is there anybody who wants to ask a question? Anybody? I can see Silas, your hand is still up.
I think that's historical, but I can still ask the last question if that's okay.
Yeah, sure, go ahead. Yeah.
So, Don, you mentioned about a position being available in your area of work. Are you in a position to share what level would that be at?
Well, I think it's not a job role. I think you're referring to the bit when I was talking about the steering committee. I think possibly.
Sorry, say that again. I missed that one.
We talking about the steering committee that I talked about at the beginning of the presentation. So currently there's like a vacancy, if you like, looking for somebody to represent the social care sector. So there is an opening there that's on the steering committee.
Okay, thank you.
I was wondering if there's anybody on the call who's actually on one of those NIHR protected time contracts, who might be able to tell me a bit about how that is balancing the work and the research at the same time.
Yes, Silas is one of them. Silas is one of them. So yeah, Silas, he I think he started on the program. When was that, Silas? You can possibly share with everyone.
I started in October 2025, and it runs for 12 months.
Yeah, so tell us a little bit about the program. What is it like?
The program itself is quite interesting because there are networking opportunities that get created along the way. There are study days that are sort of online. That happens, I think, once a month, if I'm not. Yes. Then we have live events. So far, we've had 2. The first one was in Leeds, so the second one is in London, and that is in March.
Right.
So
yeah, go ahead.
You have a network of people that you are going to be working with in groups, those that are from your background, because they are all social care nurses, but some are in care homes, some are in home care services, some are in day care services, and some work in palliative care, and some work in mental health. So there's a variety of sort of social care nurses that you are in contact with, and you get given opportunity participate or to conduct your own research. It's called, I'm forgetting the name. It's a project that you run, and you have mentors that guide you, and you have also course tutors that guide you as well. So there's a lot of support. They pay for your travel to live face-to-face events. So it's quite interesting. I think we're about 25 of us that are on the program, and we are the first one in the country because it's never been done before. So we're the pilot group, but so far so good.
Right, great. That's a great opportunity you got this, Hannah. So that's the NIHR internship program, yeah?
Yes, it's called Research and Development Program, specifically targeted at practitioners that are working in health and social care.
Right. Thank you for sharing, Silas. And Deborah, you did mention that you've got a PhD, an opportunity for PhD in palliative care. Is that still open? I'm sure there will be some who, may be interested in knowing a little bit more about the PhD, and is there funding for it in terms of tuition?
Yeah, so I think there are possible ways to get funding for people who are working in health and social care to support further education. So so I think there's ways to get funding for it by that. The actual PhD program that we do, I mentioned, is a part-time course, so you can do it alongside your working as well. And also, so it's something called a blended learning course. So it's not like a pure research course. It's blended learning, so you have lectures along the way, and so there's a bit more structure to it. And like I mentioned, that it was very international, so people really are coming from so many different countries because it's done online. But also at the beginning, so at the beginning of the course, I think the intake is in September, October, and they start off with people come onto campus for a week, and then they do some key networking events where you can meet some of the professors and lecturers and also the other people that are on the course with you. And then just some key starter, there's like a key starter module where there's some lectures to get you started. And then after that, you have modules online. But you have I think it's 5 years to complete because it's a part-time course.
Yeah.
So yeah.
And is it open for both clinicians and social care practitioners? Or
I need to double check on social care practitioners because I can check that. I'll check that for you and let you know. I'll send you an email.
okay, great. Right. Is there anybody else who would want to ask a question?
I actually have a question back to the group, if that's all right.
Sure.
We've
Go
got
ahead.
a little bit of time. Is that I know that a lot of what I was presenting was around hospice staff and NHS staff. So, and I'm just I'm curious how the barriers are working in the community, in social care in the community, so working in domiciliary care. If there's anybody who is willing to share any of that and what those barriers are, or maybe some of that anyway resonates with people with the time issue. But I'm just wondering if there are any other barriers that weren't mentioned that maybe come up.
Right. I can see Silas. Yeah, Silas, you can go ahead.
Mine is a different. I wanted just to mention something in relation to my project because it might be relevant to people that are on the call. So I'm going to wait for people to answer Debbie's question.
Okay.
Then perhaps I can just briefly mention about my project and also what's going on.
Right. So Deborah is asking if for those of us who are working in the community and domiciliary care, are there other barriers, unique barriers to this sector, in addition to what she has already mentioned? Are there any other barriers that you'd say probably they are unique to home care sector? Anybody who want to share? Anyone working with the community or is doing domiciliary care? I think there is a similarity in terms of what the experience is with what you have already shared. But I think some of the barriers, they become more prominent as you get into the community. Things like skills, there's that really deficient in terms of research skills. The more you move out of the hospital towards the community, you tend to come across people who have no idea what research is all about. Well, in the hospital sector, probably people can have some idea, but as you get into the community, people really have no idea what research and how research can be done in the community. Probably, I'll put it that way, that those barriers become more prominent as you move away from hospital, towards the community. Is there anyone who wants to add in? Anyone? What they are experiencing in terms of research, or anybody who wants to say probably that they've never had an opportunity to actually talk about research in their setting. And I think I can also add and say things like governance issue. The home care sector is one of those sectors that is very much not well connected. It operates in so many silos, and there's that governance. Governance structures are really very, very elementary, if I were to put it that way, in terms of research. So it's very difficult to actually imagine how you can manage research governance in the home care sector. Not that it cannot be done. There's still a lot of work that needs to be done to actually get the governance structures competent and confident. I think that's what I can say for now. Is there anybody who would probably want to add something? Okay. And one last question for you, Deborah. It is regarding the research development toolkit. Probably you can share with us. Is it focused on a particular setting or not?
So it was originally designed for hospice work, but I mean, I think that this is transferable. A lot of that will be of help anyway in home care. I can put the link in the chat.
Yeah. All right, thank you. Yeah. Thank you so much. I think we've exhausted everything about your topic today, Deborah. I really appreciate for coming and sharing with us. And for those who are new to this platform, we are doing these monthly meetings, particularly with an eye for the home care sector. we are promoting uptake of research across Greater Manchester, and we are doing these meetings monthly. Next month, our focus will be on PPIE, patient and public involvement and engagement. We are also hosting a research fair in Middleton Shopping Centre. This is the second time that we are having this event, and we will have a workshop in the Lighthouse. So for those of you who want to know a little bit more about research in the home care sector, of course, with a strong focus on social care, you are welcome to join us. And I've shared a few opportunities for those that joined the meeting earlier. Probably you've come across the links that I've put in the chat. NIH has opened up a few scholarships. Those who are in the adult social care, you are eligible, and you can apply. So have a look at that. It may be of interest. So give yourself some a chance if you're interested. But there's a lot more that's happening. Don't forget to share with us your email so that we get to share these opportunities as they come. And you also get a reminder of our monthly meetings. So before I close this meeting, is there anybody who would want to say something?
Hello?
Right. Yeah.
Can you hear me?
I
Well,
can
it was
hear you.
myself, Silas.
Yeah, go ahead.
I'm a research intern for social care research and development program. So I'm doing a project. This is just an introduction to everyone who is on the call. And the project itself is called Caring for the Carers. And I'm trying to understand and address work-related stress and burnout among home care support workers in Great Manchester. So I'm going to be sort of, I've got some questionnaires, which I'll ask my director, Dr. Ivan, if we will be able to send out the questionnaires to either to yourselves or to your members of staff, so that I'll be able to gauge. The main aim of the project itself is to explore the experience of home care workers regarding work-related stress, burnout, and identify practical, locally relevant strategies to support workforce well-being, resilience within the adult home care and daycare settings in Manchester. Thank you so much. So it will be just an online survey which will come through. Thank you.
Thank you, Silas. Yeah, so we've got emails for all those that registers for this meeting, so we'll be able to share out that opportunity. Just share with us, then we can, share with everyone else. But for those probably that didn't register, you can possibly send us an email. So I'll put our email in the chat for everyone to have access to. I'll put it right away. Or somebody can help me there. My chat is taking time. Right, I'll put it in the chat. Yeah, so yeah, right there. Let me just. I think that's all really for this month. I really appreciate. Thank you everyone for joining in. Let's meet again next month. And for those that are free to come into our workshop and research fair in Middleton Shopping Centre, please feel free on the 27th of February between 10 a.m. and 2 p.m. Thank you. Thank you, Deborah, for presenting. Have a good day, everyone.
Very much. Have a good day.
Bye.
Thank you, everyone.
Thank you.
Thank you.